All right, we got the questions.
Yeah, it's on the phone. I'm going to print them out for you.
All right,
Or
cool.
you can just hold the phone and look at them.
Okay. Don't you need that phone to moderate though?
Yeah, Zach's got a phone to moderate off.
All right.
We're going to
What's
finish up the questions right now, and then we have 2 phones to moderate off of. If you want to hit go live and just talk to the people, ask people where you're from type of thing, and then I'll come in with the questions. If you see a lot of questions start rolling in, start answering these because it keeps the viewers more engaged. Save those questions for later.
Say what? Oh, answer these questions?
If there's nobody in the live, use the scripted
Yeah,
questions I'm
okay,
going to give you. If
cool.
they're asking a bunch of questions, keep them engaged.
All right. What's up? Nato Predilus. Hi. Hello, everybody. We are going live. We're going to do Ask Me Anything. So Jamar Thomas. Hello. Hi. We are live here, Beverly Hills. Check it out, you guys. Beautiful day here in sunny Southern California, and we're going to go answer your questions that you guys have submitted. Hello from Boston, Mass. I just ran the Boston Marathon, by the way. That is a fun town. You guys rock. And hello, Life with Seda. What's up? Love it, love it. Yes. Detroit. What's up, Detroit? You know, Detroit's a great place. I went one time, and it was in December, and I went to the zoo, and the only thing that was happy was the polar bear. So otherwise I got to come back and visit another time. But the museums are pretty cool up in Detroit, and the casinos, believe it or not. All right. K-Dub, hi, what's up? Menace77. Hello from San Diego. What's up? Martinez, 619. Okay, I'm a mother of 2. I have a sagging belly after 2 kids. K7 Boutique, come see me. Okay. Hi from New York. What's up, New York? You guys. I hear it's pretty hot in New York right now. So we're going to answer a couple questions we have. All right. Hi, what's the best course of action for permanent removal of facial veins like broken capillary spider veins and superficial like something helps condition issues? So when it comes to broken veins and blood vessels in the face, there's a certain laser called a V-beam laser that works really well, or pulse light IPL. But I would go, if you really have problems with broken capillaries, get a V-beam laser that targets the Linda Navarro, that targets the blood vessel. Can I lift my 1-year-old baby again? After mommy makeover, yes. If you have a mommy makeover, you have a tummy tuck, you could start lifting after typically 6 weeks, but you need to follow up with your specific doctor to make sure that that recommendation is correct. If you came to me and we did a tummy tuck and we did application, you could start doing lifting around 6 weeks. Now, there's a thing called a tush baby. You hold that for a second. And the tush baby is on my post-op recovery website. It is a belt, and it has a little holster here for your child, okay? So basically you put the child in there so that you can carry around and not use your arms and not stress out your incisions, okay? So that is what I suggest to do if you are, oh yeah, here it is. Tush baby, okay, so this thing is pretty cool. I actually use this at home because I don't have any hips, but you see that thing? You put the baby on there, and then that kind of helps you. So we recommend this. We actually sell it on our website, postoprecovery.com, so that you can carry your child after a surgical procedure with ease. Because if you have that's what everybody was like. Baby turns 1, it's time to get the mommy makeover, right? But then you still have to carry the baby, and so when am I going to get this downtime, right? And it's just like this never ends. So that's why we started carrying that. That product helps a lot. But follow up with your doctor to see if that's okay. All right, question. BMI for surgery, just TS3. BMI, it's all relative. I kind of look at the bigger picture. I've definitely done some patients with BMI greater than 35, and I've done some smaller people, and it just really depends on your overall health, okay? And so if you want to know if you'd be a good candidate for a tummy tuck or any surgery from us, you guys check out our website, Dr. Daniel Barrett, virtual consultation. So drdanielbarrett.com, go to virtual consultation up at the top, and you can get that check out. And you can submit your photos, you can submit your past medical history, all your information. We'll take a look at it, be like thumbs up, thumbs down, or you need to get to this weight and so forth. I have lupus, blood clotting disorder, antiphospholipid syndrome. I have 2 PE and 1 implants. Well, Jessica, that's a tough one. If you have a big clotting problem, you're at high risk for blood clots. Depends on how old you are, Jessica. You'd have to probably check with your hematologist if you want to get a surgery done. Breast augmentation is relatively short, the risk is pretty low, but if you get a blood clot, you could die. So you kind of have to kind of figure that one out. Now, the real reason is, why do you have all these conditions? Why do you have lupus? Okay, something that you guys know, I don't know if you know, but I had lupus-like antibodies. I did my blood work about a year ago. And I grew up in Virginia, you know, pretty much crappy, poor, well, not crappy, but poor blue collar family. I would eat Eggos and I would eat Pop-Tarts. Like Pop-Tarts was my breakfast, okay? So Eggos every single day. So many Eggos every single day. Would take it out of the freezer, put it in the toaster oven. Freezer, toaster oven, freezer, toaster oven, Eggos. I would get so sick of them, I like get nauseous now, even if I see Eggos. But that's what it was growing up in Virginia, and then, you know, trying to get breakfast in before we went to school. Hot dogs, you know, milk, all this bad stuff for your body. And anyway, I had a food sensitivity test done because I just felt like I was losing energy and so forth, and I was sensitive to about 30 different foods, which is insane. You should only really be sensitive maybe one, maybe two, if at all. And what that really means is your gut is leaking all the food particles into your body, okay? So hear me out on this, guys. You got to follow me down this, and this is super important. Everything, all the autoimmune stuff in our body, most of it is coming from our gut permeability. It's a leaky gut syndrome is what we call it. So the more leaky your gut is, the more of these food particles go in. So you eat an apple protein starts circulating in your blood, triggering all kinds of immune response, right? We're not supposed to let big particles in, but if you have leaky gut, it lets those big particles in. So if you have lupus, your body's attacking certain cellular molecules in your body, which I had. So I was eating a bunch of food. All of it was triggering my immune response, and I was sensitive to everything I was eating. So I cut out a lot of the food that I was sensitive to. Like, you should see the list that I had. It was crazy. That helped, but that's just a temporary fix, right? Then I got Leaky Gut Guardian, which is now available on my post-op recovery website, which it's a gut. It has probiotic, prebiotic, and IgY Max, which helps get rid of the bad bacteria in your gut lining. And then I took digestive enzymes, and that's digestive enzymes it's like, that doesn't make any sense. I'm not lactose intolerant. What it does is it breaks down the food particles so they're not as immunogenic. So if they do get into your bloodstream, it's not a big deal. It's like a tiny little molecule that's not as problematic. And if you have questions about this, you check out Dr. Isabella Wentz, W-E-N-T-Z, Isabella Wentz, the thyroid pharmacist. You can just Google her right now. And she'll tell you how she cured her, figured out why she had Hashimoto's thyroiditis. Her own body was attacking her thyroid. That's why she was hypothyroid, okay? So she started taking digestive enzymes in it, and it fixed it. So digestive enzymes, Leaky Gut Guardian, fasting. I fasted for 5 days in December of last year. And then I retook the test. All my lupus antibodies were gone. All my food sensitivities were gone. I got down to like 2, and they're only moderate sensitivity. It was wheat, and I think another thing. And so thyroiditis, hypothyroid, it's like doctors, they prescribe you Synthroid, right? They're just masking the symptoms, right? They're not figuring out why the hell it is that your thyroid decided to shut down. Okay, certain types of diabetes, lupus, rheumatoid factor. Okay, I had a patient come in. She's like, my boobs are great, but you cured my rheumatoid arthritis from the Leaky Gut Guardian and the digestive enzymes, and talking to her about fasting. All right, so that's kind of just blew my mind. I was like, Jesus Christ, why do we not know this as regular doctors? I trained in a traditional medical school, and we didn't hear anything about this stuff, and it's still not really fully recognized because the pharmaceutical industry is really hammering into us a lot of the pharmaceutical-driven solutions for our sicknesses that are caused by our diet, our food, everything else, okay? So that's just the short end of it. A lot of it comes through your gut. So if you have psoriasis, you have some of these autoimmune things, look to your gut. Fortify your gut. Start with the digestive enzymes. You can get them on my website, my post-op recovery, Masszymes, and then the Leaky Gut Guardian as well. Okay, so let's get your lupus fixed. All right, that was the longest answer to the whole thing, I promise. How much time off does a healthy person need to fully recover from a tummy tuck and muscle repair and lipo? Penelope, I would say it's probably 10 days where you're fully out of work if you have a desk job, okay? You come here, we do a lot of rapid recovery techniques. We use X-Roll, we inject it into the glycation. We use a lot of alternative pain approaches, so like CBD, in addition to narcotics that we do prescribe, but we recommend you don't take them, and increased mobilization. So you're up, moving around. We even have these leg squeezers now that help prevent blood clots in your legs, which is also on our postoprecovery.com, as well as our CBD. The CBD we have is super strong. It's 1,500 milligrams. All of our patients, we recommend to take it before and after. You put a big dropper underneath your tongue. Gosh, we are totally plugging all these products shamelessly here, guys. Shame on me. All right, no, but seriously, the CBD works. People come in, they're like, I didn't even take any of the narcotics, right? Awesome. And then you have some people like, I want the narcotics, but okay, whatever. that happens. But so typically for a tummy tuck, it's about 10 to 14 days. But if you're healthy, pretty good shape, 10 days. Our revision rhinoplasty is really hard to recover from. They can be. It depends on what needs to be done. If you need to take a rib and so forth, that could kind of take your time down and so forth. Dr. Daniel Barrett, any injury to face that would need surgery? Yes, there's lots of injuries to the face that could need surgery. Let's see, CBD is really good. Roxanne, photography, thank you. I'm going to ask some of these questions that we have here. Okay, so we've got Seleniva. What is a good profile implant for a B cup? Please keep anonymous. Thank you. Oops. That was bad. Okay, so a B cup, a good profile, I would say moderate profile is generally the way to go, moderate profile plus. Can I have a free consultation with you, please? Liana Health Coach, you can go to virtual consultation on my website, Dr. Daniel Barrett, virtual consultation, okay guys? Or you can just call us right now. We have people standing by, 310-598-2648. Is the office, if you want to schedule an appointment, you can just give us a call. Shamelessly plugging myself now. Can you recommend a great surgeon in Toronto? Fancy Nancy 88. No, I don't know one. But we do get a lot of people from Toronto. Toronto to LA, not a big deal. We get people out of town all the time. Breast augmentation, even fully mom makeovers, right? You're investing in your body. Come spend some time in beautiful Beverly Hills, all right? Do it in the wintertime if you want. Get out of Toronto, come see me, okay? Can you do breast implant lifts without implants? Yeah, I do breast implant lifts all the time. Melissa Ivy, 34 double D, yes. So I do a lollipop technique. So it brings an internal portion of the breast up so that it looks like you have a lot of fullness. And then sometimes I can take a little bit of fat and transfer to the upper pole of the breast. So it looks like an implant, but it's just using your own body's fat. All right, Susie, 1579. I got fat transferred to my breast and I want to get another one because it's not fuller on top. How long do I have to wait from one surgery to another? Susie, well, I would suggest 3 months is fine. And then that's normal, by the way. Sometimes you need to do fat transfer to areas multiple times. And then it happens because sometimes the fat doesn't take and you need to build, okay? Look, Barrett, I want to be 6 inches taller. Can you make it happen or what? Vox? Not that I'm aware of. Although some people say that if you have a little traction machine, like which I have at my house where you kind of go like this, it can kind of relax some of the tension in your spine and maybe get like a fraction of an inch taller. Caroline Salgado, 25. Do you guys remove stretch marks? Yes, we do. We have microneedling, we have CO2 laser, and we might even get this other radio frequency microneedling device called Benev. It does wonders on stretch marks. It's not just one treatment. It does take more than that, and you only get about 50% improvement total with it done, okay? So yes, it can improve. It doesn't go away completely. If you have stretch marks in the front, then maybe we just do a tummy tuck and take it all the way out. Okay, do you accept patients with mixed connective tissue disease? Life of Michelle, yes, we do. We do. It just depends on what kind of surgery you want to have done. Some of those complications can be pretty challenging. The question is, do we have an emergency injury to the face? Should we request a plastic surgeon? Alexa, yes, sure. If you have a tiny little cut on your cheek, your doc's going to do fine. If you have a big gash through the lip and through the nose, then yes, get a plastic surgeon for sure, if you can. Or you can call my office, and we sometimes see people for lacerations as well. Do breast implants prevent breast cancer? Implants do not prevent breast cancer, but they don't cause breast cancer. They just cause increased success in getting relationships, marriage, and pregnancy. So I find that happens all the time. Come in, single girl gets breast augmentation, they go out, they get a boyfriend, they get married, and they have kids. Just totally joking here, all right? But no, so how do you feel about the teardrop implants? Let me show you guys. I have one right here. This is a teardrop implant, okay? So when they first came out, people were like, oh, they're the best thing to start using, and you know, because it has this, it looks like a breast and all this other stuff. But the problem with these is that they can rotate. And when they rotate, that can cause a problem because that thin side all of a sudden goes to the bottom side. Not only that, they tend to be firmer, and they're almost always textured, which is associated with that rare lymphoma, anaplastic large cell lymphoma. So teardrop implants are out, but the good news is round implants, when you do them in the right way, you put them underneath the muscle, it looks like a teardrop shape, versus a fake and rounded shape, okay? So you don't have to worry whether they're round or teardrop shape. You go to the right surgeon like myself, and we can make it look very natural, okay? I have implants that didn't descend. Is there a way to correct with new implants? Yes, you got to figure out, there's 2 reasons why it didn't descend. You could have very tight breasts and the surgeon didn't release them, or 2, you could have capsular contracture and they just tightened up and they never went down in the first place. So the way that you tell is you pinch them. Are they really firm or not? Okay, if they're really rock hard, then you might need to get capsulectomy to remove that scar tissue. If they're soft, then you might just need to have a release of the bottom part of your breast, inflammatory fold. Somasty revision 6 weeks later. Are there some scars left? How long patient wait before laser removing? Okay, so how long should you wait after a surgery to have laser? I generally say at least 3 months is a good amount of time. But what you want to do, what you want to do if you have a scar is tape it or follow your doctor's advice, but then start a scar gel. The scar gel I recommend is called Scanuva. It is on my website, postoprecovery.com. You guys, if you are thinking about getting cosmetic surgery and you don't want to come see me, or if you do want to come see me, check out these products. I have a lot of people that I'm not going to come see you. I'm like, fine. Well, these are the things that I recommend. All right, for your scar management, all that stuff makes a huge difference. So post-op recovery, I have kits for breast augmentation, for tummy tuck, all the other stuff. Shameless plug again. God, we're all about it. I feel like an infomercial today. Let's get down to some good questions. Let's see. How much does buffalo hump cost, and what's the recovery like? Cost is probably around $10,000 or $12,000 per my pricing, but we probably get it less for some of the associate pricing. And basically, buffalo hump is if you have fat right here, and you really do have fat, and it's not just like your bone. We can make a tiny little incision, and we can take that down with liposuction. It is painful because it's on a sensitive part of your body. But we can, and we have had success with that. We actually had a patient last week, came in, looks pretty good, but she's 6 weeks out and it's still sore. Okay, so just know that. Why do I have a lot of pain when I sneeze after a tummy tuck? Yeah, it just depends on how long ago your tummy tuck was. Alex Prince, hello from Moscow, hi. It just depends on how long your tummy tuck was. If it's been a year out, then you may want to follow up with your doctor. Why did I pick my profession? Elizabeth Williams too. It's pretty damn cool. One, I get to play with these all day, but no, really, I get to help people. I get to be an entrepreneur. We have cool products that we are really great for our patients. We work with a great team here. I get to work on any part of the body I want, and I get to make people feel good about their bodies, happy, right? When I first started, thought I wanted to be a doctor, I thought I wanted to be a cancer doctor. My hat is off to them. That is really tough. My father had lung cancer when I was growing up, so I thought that's what I wanted to do, to help all the other people like me, how my family went through, but I couldn't do it. It was very, very challenging and very depressing, and I couldn't be around that, me personally. But my hat's off to the people that are doing that, and if that's interesting to you, go for it. Do you think a gastric sleeve is safe? Yes, I do. But gastric bypass surgery is very dangerous. You have to go to the best of the best. Only go to an academic center. Don't go to a place that you find out the lap band on a billboard, okay? That's not where you want to go for your gastric, because that opens up, you could die, okay? I've seen people die from that, okay? I've seen people die from that when I was in residency who even had a great surgery, okay? So imagine you go into some chop shop and what are the odds there, okay? Do you have to do your lower face when you have a neck lift? No, you don't have to, but it's the same incision, right? So if you're gonna get a facelift or a neck lift, if say you're gonna get a neck lift, right? Same incision right here. So I often say, well, why don't we just lift this just a little bit? But if you don't want to, you don't have to. So give us a call if you want to just do the neck lift. I've done that quite a few times. How long is the recovery time for implants? Emily, I'm glad you asked. I do a lot of breast augmentation surgery, and my recovery time is 4 days. So you can go back to work on your 4th or 5th day, if it's a desk job. Okay, if you are a firefighter or a police officer, I wouldn't recommend that. Okay. The reason why is because we do a lot of rapid recovery techniques. We do a lot of minimal dissection techniques to not create a whole lot of bruising. We use a lot of numbing medicine, and we have a lot of alternative pain medications that we talk about, okay? Do you have to do a consultation for pricing? No, you can call us, or again, you can get pricing, and pricing is customized because there's a lot of things that goes into it, determines our time. On our website, Dr. Daniel Barrett, virtual consultation, check it out, or you give us a call, 310-598-2648. Okay, I have a hernia and rectus diastasis. Would you recommend a tummy tuck to fix this problem? Star Elephant, yes, absolutely. I just fixed a hernia today. And it's great if you combine it with a tummy tuck. You don't get a weird scar in your belly button, and it's safer because we're gonna be able to dissect it around. I imagine it's by the belly button. I'm assuming it is. It's around the belly button, and we go up with the tummy tuck and we just dissect carefully around it, fix the hernia, do the application for the diastasis repair, and we put it all together, one-stop shop. Okay. Emily Nguyen, we are located in Beverly Hills. Ta-da! That's a real backdrop, by the way. This is an office that we spent a lot of money for which is why I work really hard so that we can get this office at this view, which I never use because I'm down in the surgery all the time. Anyway, on 5 months post-op liposuction and BBL, and I think I still have fluids. What ways to get rid of bumps and fluids? You know, I like to do venous legacy, which is a radiofrequency skin tightening. Some people do lymphatic massage, but follow up with your doctor, see what they recommend first. Make sure there's no problems. Could be a seroma. I want round gummy bear implants, no lift and no reconstruction. My budget is $10K. Is that realistic? Just for implants? Yeah, I think so. Give us a call. What happens to your original belly button? Do you stitch it up and it leaves a scar? So your belly button, so imagine this. So we got a couple more minutes and then I've got to go because I have an interview. But if you have a belly button, basically we cut it out, we drop the periscope down, and then we bring the skin down, and then we bring the periscope back up. It's the same belly button, but it's in a different kind of spot on your belly because we're bringing all that skin back down. All right? Is it okay to get a breast augmentation at 19 years old before having a kid? Bombas Maria, yes, absolutely. I do it all the time. If you're 18, you're an adult, you can make this decision. They're very safe. They don't really stop you from getting pregnant. They can interfere with breastfeeding ability about 7 to 10%, according to statistics. So you have to take that into consideration. I'm 10 months post-op and my belly button looks swollen and weird. Now, is that normal? Sylvia, it's hard to say. I'd have to examine you. Check with your doctor, or you can come see me. What happens to your original belly button? Do you stitch it up and leave it? Oh yeah, we talked about that. And how do you fix the C-section scar? Well, you can cut it out. Alexa, Cheyenne, you can cut it out, or you can do a tummy tuck and just cut it out and then bring all the skin back down. So either way, it's great. A lot of times, here's what happens, and I'm not beating up the OBGYNs out there. When you do a C-section for pregnancy, there's a lot of hormones in your body, and the layers, even if they're closed right, they can really kind of scar down and create a shelf. Raise your hand if you know what I'm talking about, the C-section shelf, okay? And you basically want to cut that out and redo that if that happens. And that's not anybody's fault. Sometimes it is, but sometimes they do exactly what they're supposed to do. But there's a lot of inflammation and swelling from pregnancy, and their job is to get the baby out, okay? And they do a great job of that. Yes, I'm skinny, but I still have that shelf. Yes, I know. A lot of people do. Can you get breast augmentation after having a pacemaker implanted? It's a good question. I think it depends on a lot of other health, like, and so forth. So I'd have to check your other medical problems. How much is the upper and lower eye surgery? You know, Blue, I don't know. But if you submit a virtual consultation request, I'll let you know. A lot of times the lower eyelid surgery, I don't even do the skin excision. I do it transconjunctival, which means I go into the fat area and I remove it without making an incision there. It's awesome. How long do implants last? They last a long time, but I suggest you exchange them at 10 years. That's important because they could rupture over time, and the rupture rate is very low until about 10 years, and it goes up. So it's like getting your oil change. Go in, get your implant out, and put a new one in. All right, we got time for one more question, you guys. How do you feel about ideal implants? That's Carrie 85. Ideal implants are a great option if you're really worried about silicone. I'm not worried about silicone because if you cut this open, the gel is cohesive. It doesn't really go anywhere. But if you are, as a patient, personally worried about it, Ideal is probably the best thing to do. It's much better than regular saline. It's this baffled kind of solution that's in there. I do carry it, and I have done it. And maybe I could do a talk about it. But I think I have a video on my website, on my YouTube, guys. So go to my YouTube, Dr. Barrett YouTube. Dr. Barrett Plastic Surgery YouTube, and you can check out Ideal Implant, and I have a video where I did one for a patient, I believe. So that's it, you guys. Yes, we are hiring. We're hiring for lots of positions: nursing, medical assistant, administrative assistant, director of strategy and business development, operations manager. These are all things we're hiring for. And so if you're interested, shoot us an email at careers@Barrett Plastic Surgery. Careers@Barrett Plastic Surgery. Shoot us your resume. We'd love to review that for you. If you have questions about our recovery products that I mentioned, postoprecovery.com. Also, if you want some information from us, go to our virtual consultation page at Dr. Daniel Barrett. That is it, you guys. Happy Wednesday. Let's, is it Wednesday?
Thursday now.
It's Thursday. Excuse me.
We usually go live on Wednesday.
We normally go live on Wednesdays, but yesterday was so crazy I couldn't do it. So anyway, thank you guys, and I will touch base with you next week. If I don't manage to go live towards the end of this week, I don't think I will, but we'll touch base next week and submit those questions for next time. Okay, thanks. Bye-bye.